Every year, over 790,000 Americans suffer a stroke. And here's what terrifies me most as someone who has worked in emergency medicine for over 2 decades. Nearly 80% of strokes in people over 60 could have been prevented if they had recognized the warning signs that appear exactly 24 hours before the stroke hits. Most people think strokes happen suddenly, without warning, like a lightning bolt from nowhere. That's completely wrong. Your body is actually screaming at you for an entire day before a stroke occurs, but most people dismiss these signs as just getting older or having a bad day. What I'm about to share with you could literally save your life or the life of someone you love. And the most critical tip that could mean the difference between full recovery and permanent disability is coming at the very end, so please don't miss it. The reason this matters so much is that we now know strokes aren't just random events that happen to unlucky people. Your brain gives you a full day's notice, sending out distress signals that something dangerous is building up in your blood vessels. The tragedy is that most people over 60 have been taught to expect aches, pains, and odd symptoms as normal parts of aging, so they ignore their body's emergency warnings. But here's the hope. When you know what to look for, you have a 24-hour window to get help and potentially prevent the stroke entirely, or at least minimize the damage dramatically. Before we dive into these warning signs, I need to know something important about you. How old are you right now? Write your age in the comments below because the risk factors I'm about to discuss affect different age groups differently, and I personally respond to every single comment to give you specific guidance based on your age and situation. Let me walk you through the warning signs that appear in the 24 hours before a stroke, starting with the ones that are most commonly missed, and working our way to the most obvious ones that people finally pay attention to, though often too late. The first warning sign that appears up to 24 hours before a stroke is what I call the phantom headache. This isn't your typical headache from stress or eye strain. This headache feels different from any headache you've ever experienced before. Patients describe it as a sudden, severe headache that feels like someone is squeezing their head in a vise or like their head might explode. The scary part is that this headache doesn't respond to your usual pain relievers the way normal headaches do. What's happening in your brain is that blood vessels are either starting to leak or getting ready to become blocked, creating pressure changes that your brain interprets as this unique, intense pain. The science behind this is fascinating, but terrifying. Your brain has no pain receptors itself, so when you feel head pain this severe, it's actually the blood vessels and surrounding tissues screaming for help. If you experience a sudden, severe headache that's completely different from any headache you've had before, especially if you're over 60, you need to take this seriously immediately. Don't wait to see if it gets better. Don't try to sleep it off, and don't assume it's just stress. Call emergency services right away, because this could be your brain's final warning before a major stroke occurs. The second warning sign is sudden, unexplained dizziness or loss of balance that seems to come out of nowhere. This isn't the mild dizziness you might feel when you stand up too quickly or turn your head fast. This is a profound sense that the world is spinning around you or that you can't trust your own feet to keep you upright. What makes this particularly dangerous for people over 60 is that we often blame balance problems on getting older, inner ear issues, or medication side effects. But when this dizziness appears suddenly and is accompanied by any other symptoms on this list, it could mean that the part of your brain that controls balance and coordination isn't getting enough blood flow. The blood vessels feeding your cerebellum or brainstem might be getting ready to close off completely. I've seen too many patients who fell because of sudden dizziness in the day before their stroke, and they blame the fall instead of recognizing it as a warning sign. Here's what you need to do if you experience sudden, severe dizziness. Sit down immediately. Don't try to push through it, and pay attention to what other symptoms might be happening at the same time. If the dizziness lasts more than a few minutes or comes back repeatedly throughout the day, this is not normal aging, and you need medical attention right away. The third warning sign that appears before a stroke is sudden changes in your vision that people often dismiss as needing new glasses or having tired eyes. This can show up as sudden blurred vision in one or both eyes, seeing double when you normally don't, or having blind spots appear in your field of vision. Some people describe it as looking through a fog or having a curtain pulled across part of their vision. The reason this happens is that the blood vessels feeding the parts of your brain responsible for processing vision are starting to fail. Your occipital lobe, which processes everything you see, needs a constant supply of oxygen-rich blood to function properly. When that blood supply gets interrupted, your vision changes immediately. What makes this especially tricky is that many people over 60 already have some vision changes from aging, cataracts, or other eye conditions, so they assume new vision problems are just more of the same. But sudden vision changes, especially when they affect both eyes or come with other symptoms, are completely different from gradual vision loss due to aging. If you notice sudden changes in your vision, don't wait for an eye appointment next week or assume you just need stronger glasses. Cover one eye, then the other, and test whether you can see clearly out of each eye separately. If you notice significant differences between your eyes, or if both eyes seem affected, this could be your brain warning you about an impending stroke. The fourth warning sign is sudden weakness or numbness that typically affects one side of your body more than the other. This might start as a subtle feeling that your left hand isn't quite as strong as usual, or that your right leg feels heavy or numb. Many people notice this first when they're trying to do simple tasks like buttoning a shirt, holding a coffee cup, or walking upstairs. The weakness or numbness might come and go throughout the day, which actually makes it more dangerous because people convince themselves it's not serious if it gets better temporarily. What's happening in your brain is that the motor cortex, the area that controls movement and sensation, isn't getting adequate blood flow. The blood vessels in this critical area are either getting blocked gradually or are having spasms that temporarily cut off blood flow. This is why the symptoms might come and go. The blood flow is intermittent, like a faucet that's being turned on and off. The terrifying reality is that if you ignore this warning sign, those blood vessels might close off completely within hours, causing permanent paralysis or loss of sensation on one side of your body. To test for this warning sign, hold both arms out in front of you with your palms up and close your eyes for 10 seconds. If one arm drifts downward or turns over without you realizing it, that's a sign of weakness that needs immediate medical attention. Also, smile in the mirror and check if both sides of your face move equally. If one side droops or doesn't move as much as the other, this is a critical warning sign. The fifth warning sign is sudden difficulty speaking or understanding speech, and this one is particularly frightening because it affects your ability to communicate what's happening to you. You might notice that words aren't coming out the way you intend them to, or that you're having trouble finding the right words for things you want to say. Sometimes people notice that their speech sounds slurred or unclear, even though they feel like they're speaking normally. Other times, you might find that you can't understand what other people are saying to you, even though you can hear them perfectly well. This happens because the language centers of your brain, typically located in the left hemisphere, aren't getting enough blood flow. These areas of your brain are incredibly sensitive to changes in oxygen levels, and they start malfunctioning quickly when blood flow is compromised. What makes this warning sign especially dangerous is that people often feel embarrassed about sudden speech difficulties and try to hide them or make excuses rather than seeking help immediately. They might avoid talking to people or convince themselves they're just tired or stressed. But sudden changes in your ability to speak or understand language are never normal, regardless of your age. Here's a simple test you can do. Try to repeat this phrase exactly. The early bird catches the worm. If you have trouble saying these words clearly, or if they come out jumbled or slurred, this is a serious warning sign. Also, ask someone to give you a simple instruction, like point to the ceiling, then touch your nose, and see if you can understand and follow it easily. The sixth warning sign is sudden, severe fatigue that's completely different from normal tiredness. This isn't the fatigue you feel after a busy day or poor night's sleep. This is an overwhelming exhaustion that makes you feel like you can barely keep your eyes open or hold your head up, and it often comes on very suddenly. People describe feeling like they've been hit by a truck, or like someone has drained all the energy from their body in a matter of minutes. This extreme fatigue happens because your brain is working overtime to try to function with compromised blood flow. When parts of your brain aren't getting adequate oxygen, your entire neurological system has to work much harder to maintain basic functions, which leaves you feeling profoundly exhausted. The danger with this warning sign is that people often think they should just rest or take a nap, especially if they're older, and assume fatigue is normal. But when this sudden, severe fatigue is combined with any other warning signs on this list, it's actually your brain telling you that it's in serious trouble and needs help immediately. If you experience sudden, overwhelming fatigue, that's unlike anything you've felt before. Don't ignore it, and don't just go to bed hoping you'll feel better tomorrow. Pay attention to what other symptoms might be present, and don't hesitate to seek medical help if this fatigue is accompanied by headaches, dizziness, weakness, or any changes in your speech or vision. The seventh warning sign is sudden nausea and vomiting that isn't related to anything you've eaten or any stomach illness you might have. This nausea often comes on very suddenly and can be accompanied by vomiting that doesn't provide relief the way it normally would if you had a stomach bug. What's happening is that the parts of your brain that control nausea and vomiting are being affected by changes in blood flow and pressure inside your skull. When blood vessels in your brain are getting ready to fail, it can cause increased pressure in your head, which triggers these digestive symptoms even though the problem isn't in your stomach at all. This is particularly confusing for people because they naturally assume that nausea and vomiting must be related to something they ate or a stomach virus, especially if they're not experiencing other obvious neurological symptoms at the same time. But sudden, severe nausea that comes with headache, dizziness, or any other neurological symptoms is a serious red flag that something is wrong with your brain's blood supply. If you experience sudden nausea and vomiting along with any other warning signs I've mentioned, don't assume it's food poisoning or a stomach bug. This combination of symptoms needs immediate medical evaluation because it could indicate that dangerous pressure changes are building up in your brain. The eighth warning sign is sudden confusion or difficulty concentrating that makes you feel like your thinking isn't as clear as usual. You might find yourself having trouble following conversations, feeling confused about where you are or what day it is, or having difficulty making simple decisions that would normally be easy for you. Some people describe feeling like they're in a fog or like their thoughts are moving through thick syrup. This happens because the parts of your brain responsible for thinking, memory, and concentration need a constant supply of oxygen-rich blood to function properly. When that blood supply is compromised, these higher-level brain functions start to break down first. The dangerous thing about this warning sign is that people often blame confusion or concentration problems on stress, lack of sleep, medication side effects, or just getting older. But sudden changes in your mental clarity, especially when they're more severe than anything you've experienced before, can be a sign that your brain isn't getting the blood flow it needs. If you notice sudden confusion, difficulty concentrating, or feeling like your thinking isn't as sharp as usual, ask yourself if this feels different from normal tiredness or stress. If it does, and especially if it's combined with any other warning signs, this needs to be taken seriously as a potential pre-stroke symptom. The ninth warning sign, and one of the most critical ones that people need to understand, is what doctors call a transient ischemic attack, or mini-stroke. This is when you experience several of the warning signs I've just described, but they seem to get better after a few minutes or hours. You might have sudden weakness on one side of your body that goes away, or speech difficulties that clear up, or vision changes that return to normal. The absolutely crucial thing to understand is that a mini-stroke isn't a false alarm or a sign that everything is okay now. It's actually your brain's final warning that a major stroke is coming, often within hours or days. Studies show that people who have a mini-stroke have a 10 times higher risk of having a major stroke within the next 90 days, and the highest risk is in the first 48 hours. The tragedy is that many people feel relieved when their symptoms go away and convince themselves that whatever was wrong has resolved itself. But what's actually happened is that a blood clot temporarily blocked blood flow to part of your brain, then either dissolved or moved to a different location. The underlying problem that caused the clot is still there, and it's likely to cause an even bigger problem very soon. If you experience any combination of the warning signs I've described, even if they seem to get better, you need emergency medical care immediately. Don't wait to see if the symptoms come back. Don't assume everything is fine because you feel better, and don't wait until tomorrow to see your regular doctor. Now, let me tell you about the most important tip that could save your life or prevent permanent disability if you recognize these warning signs. When any of these symptoms appear, you have what we call the golden hour, but actually, it's more like the golden day. Every minute that passes after stroke symptoms begin, your brain loses approximately 1.9 million neurons. That's why we say time is brain in emergency medicine. But here's what most people don't know. If you get to the hospital within the first few hours of symptom onset, there are treatments available that can actually dissolve blood clots, restore blood flow to your brain, and prevent or reverse much of the damage that would otherwise be permanent. These treatments include clot-busting medications and procedures where doctors can actually go into your blood vessels and physically remove the clot that's causing the stroke. However, these life-saving treatments are only effective if they're given quickly, typically within 3 to 4.5 hours of when symptoms first appear. This is why recognizing the early warning signs that appear 24 hours before a stroke is so critical. It gives you time to get help before permanent damage occurs. Let me remind you of the key message here. Strokes don't just happen suddenly without warning. Your body gives you a full day's notice through symptoms like sudden severe headaches that feel different from any headache you've had before, unexplained dizziness or balance problems, sudden changes in vision, weakness or numbness, especially on one side of your body, difficulty speaking or understanding speech, overwhelming fatigue that comes on suddenly, unexplained nausea and vomiting, sudden confusion or concentration problems, and mini strokes where symptoms seem to get better on their own. The myth that strokes are unpredictable events that you can't do anything about is completely wrong. Your brain is constantly communicating with you about its health, and when you learn to listen to these warning signs, you have the power to potentially prevent a stroke or minimize its impact dramatically. Your body has an amazing ability to heal and recover when you give it the right support at the right time, but you have to act quickly when these warning signs appear. Even if you've never had any of these symptoms before, knowing what to look for can help you recognize them in yourself or a loved one when every minute counts. You're not powerless against stroke. Knowledge and quick action are your best defenses. Remember that small changes in how you respond to warning signs can make enormous differences in outcomes. You're not alone in this, and recognizing these signs early gives you the best chance of getting the help you need when you need it most. If this information could help someone you care about, please share this video with your family and friends who need to see it. Make sure to subscribe and turn on notifications so you never miss life-saving health information like this. I'd love to hear from you in the comments. Which of these warning signs surprised you the most, and what other health topics would you like me to cover in future videos? Your questions and experiences help me create content that truly serves your needs.